So very good morning to everyone. As we all know that soon you people have to prepare for your exam, and as you enter into the field of pharmacy, which is very noble, very interesting, and a field where you can do as much as you want. So there are tremendous opportunities in this field. So today we are here to um, help you just to know that in your semester how you have to solve the multiple choice questions, which are actually an inseparable part of your question paper. So I know that you people must be really working hard and applying your all your effort to get very good marks in your examination. It's my small effort for you people to understand that how the questions are normally coming, how easily you can solve it and get very good marks in your exam. Apart from it, you can understand the concepts of this subject pretty well. So let us start with some of the question and enjoy this session of pharmaceutics. So the question number one here is asking about a dry substance which composed of finely divided particles is known as what? So we all know that tablet, capsule and powder, they all are dry, but they are not finely powdered particles. So in this question number one, answer number C is the correct, which is actually the powder, which is finely divided solid substance and is used as a dosage form also. Question number two, the Pharmacy Council of India was established in 1948. And question number three, which talks about the medicated powder intended for internal use is, so it is internal, not external. If it is external, then option number B could be the correct answer, but since they are talking about internal, then option number A, that is oral powder, is taken by orally, which is an internal route, and then it will do whatever effect the drug it is carrying. Then question number 4, which actually asks about the 6th edition of IP, which was published in 2010. Question number 5, which actually asks about a medicated powder intended for external use is. So as before a couple of seconds I told you that topical powders are the powder which are externally used. So in question number 5, answer number B is the right answer. In question number 6, it is being asked that according to Indian Pharmacopoeia 2007, oral powders they are actually finely divided powder. For question number 6, answer number A is the right choice. For question number 7, which actually has a query of the advantage of the powder. So I think powder it is a dosage form which can be individually weighted, because you can weigh it individually. It placed over the paper, so we are placing it over the paper so that it can be dispensed pretty well. The paper is enveloped, and it even can be given in small vials and bottles. So for question number 7, option number A is the perfect answer. Question number 8, infants and young children who cannot swallow the tablet or capsule will accept this dosage form that can be mixed with the formula or sprinkled in a process or some other appropriate food. So the sprinkling, which is actually spreading with the help of any kind of a container, and spreading of the powder can be done very easily because it's fine, it can be spread easily, and it doesn't take too much pain to swallow these dosage forms. So for question number 8, answer number C is definitely the most appropriate answer. Question number 6, MDI are what? So MDI is abbreviation, and the full form of the MDI is meter dose inhaler. So option number B is not correct. It is not inhalation, it is not ingestion, nor it is infusion. So it is meter dose inhaler. For question number 11, which actually asks about question number 10, if a drug is too bulky to be prepared as a capsule or tablet, what should be the suitable dosage form? So if the dose is really high and you cannot compress it as a tablet, or you cannot fill into the body and cape of the capsule, then the suitable dosage form for these kind of drug should be powder. So for question number 10, option number C is the right option. For question number 11, powders provide a rapid onset of action because they are they really disperse, definitely, because since they are fine particles, they can disperse very easily. Have a large surface area, definitely it is a large surface area because it is a small size. Point number C, usually require dissolution, not disintegration. So if we consider that tablets are actually having, if I'm not wrong, a macroscopic structure where which disintegrate first and then it is converted into the disaggregate structure, then it converted to the powder form and it get dissolved. But in the case of powder, it only need dissolution, no disintegration. So for question number 11, answer number D is the appropriate answer. For question number 12, powders are not suitable dosage form for the administration of the drug. So here they are asking about the nature of the drug which cannot be suitable to be given in the powder dosage form. So here the drug which can be deteriorate with the exposure to the atmosphere, or they are or environment, or in acidic pH, because stomach do have acidic pH, so they cannot be given into the powder dosage form. Second, they are inactivated in the stomach, so if the drug is inactivated in the stomach, then also it cannot be given into powder form, and it can cause damage into the stomach, then also the powder dosage form is not suitable. So for question number 12, answer number D is definitely an appropriate answer. Now let's talk about question number 13, what it has. It is asking the fourth edition of IP was published in 1996. For question number 14, powder are not well suited for dispensing, and these two powder, which is hygroscopic nature or even the deliquescent. So here in the sense, the powder of the drug which has a nature of hygroscopicity or deliquescent, so these cannot be used. So for question number 14, answer number C is the right choice. For question number 15, insufflators are fine powders of the drug which are dosed into. So insufflators are dosed into definitely the body cavities. It can be nose, ear and throat. So for question number 15, answer number D is the right choice. Now let's move ahead with the question number 16. So what it has, or rather than 16, for number 14, who was the father of this medicine? So here the option which is given is Hippocrates as the correct one. 15, powder that are designed for external use, so it is applied externally and acting as a therapeutic lubricant or protective purpose, and that is only the powder which is dusting powder, because insufflators are there for body cavity, bulk powders can be taken orally. So dusting powder are the one which is giving for the purpose of protective, the purpose of lubricacy and the therapeutic purpose, because it carries the drug also. Question number 16, the bulk powder in which the individual dose has been pegged separately is known as divided powder. So for question number 16, since it is pegged separately, so it is divided powder which can be pegged separately, and it is again a kind of powder dosage form. Now let's move ahead with the question number 17, which asks about the drug present in the bulk powder are betterly suited if they have first wider therapeutic window, large dose because it's bulky, pleasant taste, it should be there because it is high quantity. So option number D is the right option for question number 17. Question number 18, a mixture of all the material packed in a properly designed bulk container such as glass and plastic bottle is known as bulk powder. So for question number 20, the first edition of IP, which was published in 1955, so the particular answer for question number 20 is option number C. For question number 21, the second edition of IP has published, like it was published in 1966. The Unani system of medicine is originated in Greece, so it is neither India nor England, it is definitely Greece. So for question number 22, answer number B is correct. For question number 23, the third edition of Indian Pharmacopoeia was published in 1985. I have a request to all of you, the student, that Please remember these editions, like whether when it was published first, second, third, fourth, fifth, or probably where first United States Pharmacopoeia was published, or basically when the first edition has come. This not only actually comes in exam, but you should be well aware with these answer anytime, since you are adopting this profession as a profession of your career. So let's move ahead with the question number 24, that is, potent drug must be given as such, that is given in question point number B. No, because if it will be given as such, there might be some problem which may observe. So they are mixed with the diluent, and then they are being given to the patient. So for 24, option number A is the right answer. Question number 25, Unani system of medicine was introduced by Hippocrates. So it is not Galen, neither A and B nor D, it is point number B. Let's move ahead with the question number 6. Powder is definitely a solid dosage form. It can't be liquid or it can't be semi-solid. It is definitely a solid dosage form. So option number A is the right choice. Question number 27. The first edition of Indian Pharmacopoeia was published in. So it's not first, it is fifth edition of the Indian Pharmacopoeia was published in 2007. So for question number 27, option number C is the right choice. Let's move ahead with the question number 28, which actually asks about the 7th edition of the Indian Pharmacopoeia, which was published in 2014. What is USP? It is definitely the United States Pharmacopoeia. So it is not United States Pharmacology, nor it is United States Pharmacy or United States Pharmaceutical. The answer is C, which is United States Pharmacopoeia. Question number 30 is again asking about the first USP, United States Pharmacopoeia, was published in. It is in 1820. The first USP got published in 1820. Now let's move ahead with the question number 31, and it has a question that which method are used when the potent substance are aided with large amount of diluent. So for dilution of the potent substance that are in powder form, we use geometrical dilution method. So for question number 31, option number C is the correct one. For question number 32, dash finally divided solid dosage form of medicament which are inhaled in nostril. So basically the powder which can be inhaled is snuff. So option number B, that is snuff, is the right answer for question number 32. Let's move with the question number 33. It's asked about the powder that contain material which react in the presence of water and evolve carbon dioxide. So while teaching you people many time in the class, I told you that effervescent powders are the powders which actually evolve carbon dioxide, and that's how the rapid disintegration of the system take place, and that's why they give better effect in less time. So let's move. So answer number C is correct for question number 33. Move ahead with the question number 34. Here the first national formulary was published in 1888. So for 34, answer number C is 1888. For question number 35, dash are the bulk powder in which individual doses has been pegged. So these are the divided powder where individual dose is pegged and it is being dispensed. So for question number 35, answer number B is the right one. For question number 36, when two or more substances are mixed together and they liquefy, this is due to the formation of eutectic mixture. So for question number 36, the right option is question number B. Now let's go ahead with question number 37, what it has for us. So it is very important question. Father of Indian pharmaceutical education is Professor M.L. Shroff. We should be proud on him that he is the one. Because of him, we are actually in this noble profession. Question number 38, hygroscopic powder must be supplied with separately. No, because they have a large surface area, so they get moisture very easily, and they cannot be given as a dosage form. As a granule, yes, because as we increase the size, the surface area get decreases, and in that particular condition the rate of the absorption of the moisture will be less, and these powder will be having more stability as compared to option number A. So for question number 38, option number B is the right choice. For question number 39, supply of the efflorescent substance is the best way of dispensing with what? So efflorescent substances are being supplied with the anhydrous salts. So for question number 39, answer number C is the appropriate choice, because option number B is not an appropriate option because it is a dosage form. So how a dosage form can be the option for it? Powder is cannot be a appropriate choice, and D is definitely not the answer. So for question number 39, option number C is the appropriate answer. For question number 40, let's see what it has. The supplement to the first edition of Indian Pharmacopoeia, which was published in 1960, the drug converted to the suitable form are known as. So if a drug has to be converted into the form, it has to be converted to suitable dosage form. So any API which cannot be given directly to the cavity until it is not converted into the dosage form. So dosage form is actually a delivery system which deliver a drug from outside to into the human body, and we will get the therapeutic effect of it. Now question number 42, that tablet triturates are also called a molded tablet. So for question number 42, answer number A is the appropriate answer. Now let's see what question number 43 has. So in question number 43, it is being asked that bulk powders are definitely not potent. They are potent. It's wrong. They are non-potent, and that is why for question number 43, answer number B is the proper choice. Question number 44, what will increase if the bulk of product should be increased? So for bulking of the product, we always use diluent. So the right option for question number 44 is option number B. Let's see what question number 45 has. So it is a mean for applying into the body cavity like nose, throat and ear. So I told you that insufflations are the type of powders which are applied into the body cavity. So it is not snuff, neither is dusting powder, it's only option number 3. So for question number 45, insufflations are the right answer. For question number 46, the question is which powder must be sterilized before their use? So it must be a powder which is coming in the contact with the blood, and in this particular case the surgical dusting powder is the powder which should be sterilized before their use. So for question number 46, the appropriate answer is D. Now question number 47, which actually is asking about dentifrices. So where actually they are being applied? They are applied on the tooth for the cleaning of the tooth, to remove the dirt from the tooth, and it gives the abrasive action. Because of that, the dirt can be easily removed, or probably whatever tar is being deposited, it can be easily removed. So dentifrices are applied on the tooth. So option number 2 is correct. Now question number 48, which actually asks about the full form of Indian Pharmacopoeia, that is IP, and you know pretty well that the answer of this question is A, that is Indian Pharmacopoeia. Now let's move ahead with question number 49. This is the last slide of this session. The concept of Triyodosha finds in origin in Ayurveda. So being a pharmacist, we should have pride that we born in the country where Ayurveda has originated from. So the answer of the concept of Triyodasha is originated in Ayurveda. The second last question is sketches are made up of rice paper. So it is not made up of gelatin or wheat paper, it is made up of rice paper. So for question number 50, answer number B is the appropriate one. And similarly for question number 51, powder with absorbed moisture is known as hygroscopic powder. So for question number 51, answer number A is the answer of choice. So thank you everyone. I hope that you people will pass this exam with the flying color, and will definitely understand the deep concept which lies somewhere in pharmacy, and you can utilize it in the in future wherever you will definitely do the research and development work in this field. So thank you everyone. Best of luck for your exam once again.